because in the end, medically, it is not the best thing.
That's true. We are running out of time, but I have to come back to when you mentioned that you're saying psychosocial problems.
Yes.
I have to bring this up before
Thank you.
before time ends and elaborate more on that. So how can those patients who are actually having psychosocial problems present to you in a polyclinic?
That's actually a slightly tricky question because it requires number one, which we mostly, thank God, are more or less equipped to pick up these signs, because we are trained that many times the physical complaints are actually just a manifestation of stresses in life. It could be psychological problems, it could be social problems. As a very simple example, a mother who comes to us telling, I have this chronic headache, rather than just sending her off for a lab test and giving some strong painkiller, we'll dig further into her social history. She may be having 4 or 5 kids, she may be a working mother. So there lies the problem. She's a what we call a snowed under mom. She is stressed, she is overworked, she may be just basically calling for help. So sometimes making the patient aware that not every problem is something physically related, it is something to do with social or psychological stresses, it helps a lot. And studies have found that merely explaining and enlightening the patient about the issue of this role helps a lot in relieving the patient's stress. The mere fact that the patient realizes that it's not just in the body, it is something to do with the environment, that in itself is a form of treatment. The other thing to do, if we have more severe cases like depression, we pick them up by certain symptoms. As an example, low mood, low appetite, things to do with not wanting to do their daily activities like they would generally do. Then we turn to dig further into them, picking up the history, asking further questions, and there are medications which are perfectly safe and can really bring about a drastic change in his mood.
All right. So unfortunately, Dr. Brahim, we're running out of time. Thank you very much for coming to us. It's really been a lovely interview with you.
Thank you.
Thank you for accepting an invite.
Thank you so much. Thank you.
All right. So ladies and gentlemen, thank you very much for tuning in with us this week. So we hope to see you again next week, and enjoy your week then. Good night.